Endothelin-1 receptor antagonists, or ERAs, are a medication that blocks the effects of endogenous endothelin-1, or ET1. Endothelin-1 is a peptide hormone produced by vascular endothelial cells, or the cells that line the inner surface of blood vessels. It predominantly binds to endothelin type A, or ETA receptors in vascular smooth muscle, causing vasoconstriction and increased cell proliferation. But endothelin-1 also binds to endothelin type B, or ETB receptors, but to a much smaller degree, and causes vasodilation. Endothelin-1 receptor antagonists work by competing with endothelin-1 for these receptors, and in doing so block endothelin-1's effects, resulting in vasodilation and decreased cell proliferation. 3 orally administered endothelin-1 receptor antagonists are available: bosentan, macitentan, and ambrisentan. Bosentan and macitentan are non-selective, blocking both endothelin type A and B receptors, whereas ambrisentan is selective for endothelin type A receptors. These medications can be memorized by remembering that they end in -tan. Endothelin-1 receptor antagonists are used to treat pulmonary hypertension. Their ability to cause vasodilation lowers blood pressure in the pulmonary circulation, while their ability to decrease cell proliferation may have a positive impact on vascular remodeling. Unfortunately, endothelin-1 receptor antagonists can cause severe adverse effects, such as headaches, flushing, peripheral and pulmonary edema, nasal congestion, reduced sperm production, birth defects, anemia, and liver injury. Endothelin-1 receptor antagonists should not be taken with severe liver impairment, as they can cause a dangerous increase in the medication's plasma level. Additionally, this medication is unsafe to take while pregnant or breastfeeding, as it is known to cause severe birth defects and harm to infants. Endothelin-1 receptor antagonists are also contraindicated with severe anemia or heart failure, as they can worsen these conditions. Fluid retention caused by endothelin-1 receptor antagonists can increase strain on the heart. And finally, some special considerations. Individuals undergoing this therapy require regular blood work, including liver function tests, complete blood count, and for women, HCG levels. These are used to monitor for liver injury, anemia, and pregnancy. Anemia caused by endothelin-1 receptor antagonists tends to stabilize within 4 to 12 weeks of starting treatment. If liver function values are significantly elevated, a doctor may decide to pause or discontinue the medication, as doing so reverses the damage. In addition to monitoring liver function tests, it's important to monitor for signs and symptoms of liver injury, such as nausea, vomiting, fever, abdominal pain, lethargy, and jaundice. Furthermore, women taking endothelin-1 receptor antagonists must use reliable contraception to prevent the occurrence of birth defects. However, hormonal birth control alone is insufficient, as endothelin-1 receptor antagonists can accelerate its metabolism. Bosentan in particular also accelerates the metabolism of some medications such as warfarin, an anticoagulant. And when bosentan is taken with glyburide, a medication for type 2 diabetes, the risk of liver injury is significantly increased. Unfortunately, endothelin-1 receptor antagonists have multiple drug interactions that can either increase or decrease the plasma levels of the medications involved. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!